Welcome, ladies and gentlemen, to an extraordinary episode of Invincible Innovation. I'm your host, Adi Mazor Kario, product design and AI expert, and today we have a visionary guest who is at the forefront of revolutionizing mental health care. Our guest is an experienced entrepreneur and co founder of a groundbreaking company that has developed a therapeutic social robot named Marco. So let's dive in and welcome my guest. Hi, Jacob.
Hi, glad to be on.
Jacob Boyle is the CEO and founder at Marco Health. We're live on LinkedIn, YouTube, and Facebook, and you're so invited to join the discussion and ask questions. So before we start with exactly what you're doing, we started talking before, and you told me how did you become to do what you're doing right now and to have a mental health robot. So tell us your story.
So I like to say that I've kind of had two themes follow me my entire life, whether I like them or not, and that's robotics and mental health. And one was always very personal, and one was always very professional. So I'll start with the robotic side, which, if you could guess, was the professional. So all through middle and high school, I had done like Lego League, First Robotics. For those who aren't familiar, they're like the high school level global robotics sports championship. Um, and when I went off to college to study mechanical engineering, really I wanted to study aerospace and launch things out of the atmosphere, but I couldn't get away from robotics because my freshman year of college, I got picked up by a military robotics startup to be an intern. But since it's a startup and you can, be underpaid and, and worked as much as you want, I became a very important um, person at that company. I ended up becoming their lead engineer on a large U.S. Navy contract for explosives, ordnance, and disposal robots. And I thought we were building systems that would defuse bombs until after I built the dang thing. I found out from the program director at the Navy when he held up a grenade next to the robot that it was going to be a bomb. So I that didn't sit well with me, and so I decided to quit that. But I was like at this point in my junior year of college, it's starting to get that point where you have to think about what do you want to do post graduation. And I, had given all of my time and effort into this previous company, and I was like, what do I do now with all of this time, effort, and skill? And this is where the mental health side started coming in. So mental health was always very personal for me. I found out pretty early on in my life about serious mental illness like chronic depression, chronic anxiety, suicide. Um, I've struggled with all three myself. I've had family members hospitalized for serious mental illness. I've lost family members to substance abuse. And knew a lot of people who were self-harming, and it was something also I've been through. And so personally, I kind of always saw it as, even just 8 years ago when I was in high school, not as many people were talking about mental health. It's not like today when we have TikTok and everything you scroll through is someone else opening up about it. Since I saw it so personally, I understood that I wanted to be there for people who were struggling with their mental health. Because a lot of people weren't getting care. Not a lot of people were talking about it. A lot of my friends and close family were really struggling. But I never really thought of pursuing it as a career. It was always like, this is my personal mission. That becomes really difficult when you are going to school in New Jersey, working for a company in Connecticut on a project that has to be delivered to a base in Maryland, and you have no time for anyone but your engineering work. And so it kind of came this like soul searching and like problematic moment where they merged, where um I had gotten back from this just devastating day of trying to deliver this robot system to the Navy, and it completely failed, and I was the only person working on it, and I was so tired, I was so frustrated. And funnily enough, as if I didn't have enough going on in my life at this time, my original co-founder had invited me to be a part of a business plan competition at our school. And the way he pitched it to me was they had two business majors and they just needed an engineer to make up whatever idea they came up with, and we'd split a $30,000 prize three ways. That was how he
Sounds good.
pitched it to me. Yeah, it sounded good at the time. But when that night I got back to campus after this failed delivery to the Navy, and I was, devastated. It was a long day of long weeks, and just culminated in utter failure. And we were trying to think of what idea to pitch. And at that time, I was also starting to see all the messages I had missed that day from being, on a military base where there's limited communication. And I saw a lot of people had been reaching out in absolute distress, like contemplating suicide. I was the only one who knew what was going on, and I just couldn't be there for them. And it just hit me like a ton of bricks, and something in that kind of clicked where I was like, well, I hate what I'm doing with my talents in this job, but this is ultimately like my career path. I'm going down the engineering way. Um, this is the problem I see where, people have no one. They have me and I'm not even there half the time. And something there kind of clicked and was like, well, what if we took my engineering knowledge and just made something that could be there for people when they were struggling with their mental health when they couldn't get anyone else. Someone like patient engagement essentially is the formal term is before you can even be seen. And the original idea wasn't even, a robot because I was kind of tired of them. It was what if we just I think the first thing I proposed was like a Facebook Messenger chatbot, which is funny because that's how Wobot, one of our big competitors in the space, started as well. But when we started doing customer interviews and customer research, as well as like scientific research into the idea, we found that people really hated apps for mental health, and not all, but when it came to like real serious, needing someone to talk to, like looking for a therapist, apps just didn't cut it. And so I said, well, I know from my time in military robotics that having something there can have an immense psychological impact. I mean, I knew soldiers who had PTSD from seeing their bomb diffusal robots get destroyed in the field, and that just drives around. It's a little tank that you remote control. If we put this clinically effective software into into something, it's going to have that. Our hypothesis was it would have a real impact, a significant impact. And sure enough, as soon as we put together this little blue frog looking prototype thing, it was horrendous, but all of the like, bells and lights started going off once people saw this and said, yes, this is what we've been missing.
So what you're saying, first, I love the story and I love the fact that you found a way to use your talents and passion in the same way. Most people either have their hobbies and the things that they love to do, and they have their career, which is not always their what they value, what there is, where their passion is, what they really want to do in life. So merging the two is a real success as is. And I wanted to ask you, you said like people hated the fact that they needed to interact with an application that sends them messages only or chatbot for mental health. So what did they hate actually? If they got the answer, they got the attention of an AI or some kind of a bot.
So
What was missing?
the big thing was really that connection. And I mean, this is from, we can talk about, the studies published about what chatbots and mental health are good for and what they're not really great for, and the actual like clinical merit of them. But from that anecdotal, what's stopping people from choosing a chatbot over something else? Um, and it wasn't just chatbots, it was also like all mental health apps that were being used for this kind of reaching patients before they can be seen, or getting them support when there's an acute episode. Um, the big thing we heard, and I'll use as a case study. So I'm from New Jersey. One of the big colleges here is Ramapo College, and I've been speaking to their director of counseling about their challenges getting mental health care to students, because that's really where we started focusing. It's such an important age range. 14 to 24 is when 75% of lifetime chronic mental illness develops, and if you don't get it at that first instance, it's kind of like game over. You can keep treating it, but it's going to come back if you don't address it properly the first time it comes up. So I had been speaking to her, and I said, "Do you use any, mental health apps in your practice? Any technologies to really reach students before they can even be in their center?" And she said, "Yes, we had one. I think it was called like Tau Online. It was, a very clinically proven system, that they were trying to step care because they had way too many students coming into their center. They couldn't all be seen. So they gave this out as, you can engage with this before seeing someone. And at the end of the semester, they asked, how did this go? And everyone kind of came back and said this was the worst. They
Wow.
essentially got like burned at the stake because the big thing they heard was, we came in here for someone to talk to, and you gave us a screen just to tap through modules on. And even with the chatbots, it's a little bit of an improvement because it's a little more of that someone to talk to. But if it's not, you know, that real connection and it just feels like another screen, um, there's a real loss of connection just based on that, subconscious psychological bond to something real.
Yeah. So what you decide to do is to take your abilities to create a robot, a real live tangible robot, and the understanding of mental health. And how did you do the merge? How did you decide what would be the best solution, taking both of these like solutions and merging them together?
Yeah. So, and I have one here
Oh, he's
to
here.
sense. So this is Marco, the mental health assisting robot companion. He hasn't always looked like this. This is the latest model.
He's
Um,
cute.
so
So, all the ones who are just listening to the podcast, you're missing a very cute creature who looks like a small bot with a hat or
yeah,
a hoodie. I would say a hoodie.
he's meant to kind of be designed after like an astronaut. That was so going into like how it kind of came about. Um, when we were doing our customer research at first, it was just trying to understand what would fit well, and that's how we kind of arrived at the idea of the robot. And the first design was just me kind of going through iterations of sketching and CADing until I had some kind of a design that I could make just one for this business plan competition. But when it actually came down to going into production, we did hire a industrial design firm or product design firm to do a little research, come up with concept sketches, which then I took and CADed into the final product. But on the actual software side, this was where we had to do a lot of learning because I'm a patient. I'm not a mental health professional. Uh, I understand everything from the perspective of what it's like to go through these issues and what helps me personally, but I didn't really understand the science behind it. So that's where we had to start going to um, on my college campus. We had counseling and preventative services, and this is the College of New Jersey is where I went. Um, they, I reached out to them, and a lot of their counselors said, "This is an amazing project. We want to advise you." And we would just sit down with them for like an hour meeting once a month, once every other week or so, and just go through what do we need to implement. What's from your perspective, what needs to go into this from both the science as well as what would help you if you were using this with clients. And that's how it sort of formed the base. And over the years, we've added on actual clinical team members. Our chief medical officer, Dr. Nathan Krishna, is a board licensed psychiatrist. Our chief customer officer, Tina Mulligan, is a licensed professional counselor for high risk youth. And they're actually now able to kind of inform what science goes into this, how does it actually work in terms of the behavior therapies it uses, and then it's up to myself and the engineering team to figure out, okay, how do we take that and put it into the AI in a safe and effective manner within the realm of what's technically feasible in this day and age.
Yeah. So can you just explain how Marco, this show it again?
Yeah.
You want to see it? It so cute. He's transforming the landscape of mental health care. So what does he do? Let's say I'm very, very sad, maybe even suicidal. What would I do?
So the big pain point we're trying to solve for those struggling with their mental health is that Marco is someone to talk to 24/7. So if you're in an acute situation and you can't get anyone else, you can just power Marco on and start talking right away. So a session with Marco is structured um, very much like a cognitive behavioral therapy session. So it starts
Mhm.
with a bit of a pre-screening saying, how are you feeling today? And you could say like, I'm feeling very sad for whatever reason. And um, it uses generative AI to take that and personalize what it says next. And then it goes into a talk session, which can either be structured like friend or a counselor, depending on what level you kind of came in at, where as you're talking, you get to feel like you're just opening up about whatever you want. You can even if you're just like lonely, you can talk about, you know, the latest show you're watching, or family, or whatever it may be. And what Marco's actually doing behind the scenes is analyzing what you say and how you say it and how you look while you say it, to piece together where are the thoughts, feelings, situations, and behaviors that are affecting you the most, and physical symptoms. Sorry. Um, and it ties all of that together. And if there's something like, okay, you're feeling very sad because you said that, I don't, let's say you're feeling very sad because your boyfriend broke up with you, and you think that you are worthless because he broke up with you, and that's making you, cry. That's the physical response.
Yeah.
Let's take that and work on the thought, because that's the thing that needs to change in order to improve. If we change the thought, the feeling, and physical symptoms will slowly start to improve and build resilience towards um, keeping it that way in the future. And then it goes into the activity phase, where Marco has hundreds of different psychology based activities that we broadly categorize into four different groups: companionship, which is like gamified versions of mental health activities; mindfulness and meditation, everything from meditations to more proactive stress relief tools like time and productivity management skills; talk support, which is the more counseling oriented CBT, cognitive behavioral therapy focused uh, mini dialogues to work through some more serious distorted thinking; and then biofeedback, which is all focusing on using physical activity to improve your mental well-being. But if, like you said, if someone's suicidal, that's a bar where Marco shouldn't really help, or any just digital mental health tool should help at this point in time. Where the technology definitely isn't ready for that. So that's where we need to get human intervention ASAP. So what Marco does in that case is he'll text message your emergency contacts saying, "This is the situation. This is how severe it is. And these are the clinically recommended steps that you should take to get them help," which is anywhere from check in and just ask how they're doing, to call 911 or 988 or whatever the emergency line is in your country, because Marco's not just US, it's all over the world.
Yeah. So you mentioned that that Marco is seeing me, meaning he has a camera and he knows my mental and physical health. So he connects to my watch, or how does he know if I have like high blood pressure, or my pace of heart, whatever?
Yeah, so depending on the model, because we do have a few different models. So yeah, there's the camera in the nose, which can do both face and gesture recognition, for picking up on some of those other things. So we are working on making Marco a bit of like a Nest, where you can connect different smart health devices to him. That part's in progress. We plan to roll it out over the coming months and year. But some models do have some built-in sensors beyond the camera, like the pulse sensor and so forth. So you don't even need all of that if it's a place like used in a hospital, or used in an inpatient unit, where you might not have like your Fitbit or Apple Watch, or whatever, and everything needs to be contained in the one device. That's how it's able to do that as well.
Hmm. And is it, you mentioned that it should be connected to people that care about me? Is it like my therapist or my friends, my family, or it's not connected to a therapist in any way?
So our goal ultimately is to strengthen therapeutic alliances between providers and patients, because we see, you know you can't just replace therapists, you can't just replace providers, but there's an enormous gap. Like, our goal is to replace nothing, and there's two kinds of nothing when it comes to mental health. There's the nothing of, I can't see anyone, and in that case Marco is there for, doesn't need to be connected to a therapist or provider, because there is none that this patient has. This is something that you bring to your home and get support until you're able to find someone, whether you're actively looking or not. It's the goal is to hold over. And then the second nothing is, you already have a therapist, and it's in between sessions, because it might be, especially for school based systems, it might be a whole month before you see that therapist again. And in that case, Marco's already connected to the therapist because likely they're the one who assigned it to that patient, and is actually able to help support their care for you, by doing remote monitoring. So not just those emergency contacts, but we have an EHR compatible dashboard that shows things like mental health screenings, discussions you had with Marco. What do you need to what does the therapist need to know that you're not telling them because either you don't have time or you haven't built up that rapport and trust yet? As well as, a big part of therapy is building habits, actually working on things you do during the session, in between sessions. And Marco, the therapist, can assign individualized treatment plans through Marco to make sure the patient does that between sessions, like in the week or month, because I think it's something like 50% of clients drop off within the first 2 weeks of keeping up with that, up to 80% within the first month. And that's a serious blow to efficacy of care. So it can
Yeah.
be used both ways, but at minimum, we recommend family, and if you do have a therapist, that it gets connected to them to at least let someone know when you're in an emergency.
Yeah. So you mentioned four modules or options that you could do. I need to decide if I'm working with a companion, a friend, or a therapist, or Marco would decide based on my mood who should talk to me?
Yeah, so it is flexible to do both. So if you come in and you just start a session, um, you can pick like, oh, I just need a friend today, or I need the counselor today. But if you say something like, you know, um, I feel uh let's see, if I said like, oh, I feel lonely today, Marco might lean towards let's set up a friend chat. And then of those four modules, based on what you say in that friend chat, he'll say, okay, you're really lonely. You need just something to boost your mood. Let's do something fun. But if you were if you came in saying like I'm lonely, and then it starts going into like actually I'm more stressed, just the loneliness is like the first thing that came to mind, then he might recommend the meditations and mindfulness. But if you came in saying, I'm super depressed because my life is going nowhere and I'm just going to die alone and sad, that's a lot of distorted thinking. And Marco will say, let's talk about that as the counselor and actually build those skills to counteract these thinking, understand where they're coming from, and come up with alternative and more balanced evidence based thoughts to counteract these negative ones. And
Mhm.
then that'll be an automatic system of here are the best activities for you, because it's the counselor side. You might not know what all of these skills are for, and it oftentimes is a lot of jargon as much as we try to reduce it.
Yeah.
So that would be like an automated, we're going to work on this skill with this goal. So it's really
Okay.
flexible that you can use it how you want. And if you don't really know, that's where the intelligent suggestions come up.
So I guess that you've seen people use it and interact with it, and I'm sure that you have lots of stories. So what has been the most surprising and unexpected interaction you've witnessed when people use this robot?
So, I gotta say, I mean, there's a few. The thing that surprised me the most, going back to, the difference between having an actual physical robot and just an app. So, in response to the COVID pandemic, we did release an app version of Marco because we were advised by a number of um, governmental health groups, don't ship Marco during the pandemic. Don't build them. I mean, supply chain was a nightmare that we couldn't even build them. But yeah, even if we could, we were told we don't know enough about this disease at this time. Like, don't send them out. Just do a digital offering. So we didn't really have much of a choice. And so we released it, and it started gaining traction. But what was incredible, we ended up doing a study over the 2 years from about 2020 to 2022, comparing interactions with the robot versus interactions with the app. And keep in mind, they're pretty much feature identical except for the physical thing. Um,
Yeah.
Robot users were engaged on average 11 and a half times longer than app users, like total time until they started churning. it was the difference between around 22 days to well over a year, and we kind of measured it as going down to around one session a week was what we consider that churn point, one session a week or less. And the time during which they were engaged for the app versus the robot was also significant. It was a difference between around 11 minutes to I think around like 34 minutes. And
Wow. That's a long discussion, 34 minutes.
yeah, because
It is,
it is. It's almost like the length of a therapy session with a human. Um,
right?
and what was also interesting, because from these people, we don't collect personalized data, but we collect anonymized data of conversations, just so we can quality control and make sure that Mark is responding the right way. And what we're noticing is in app-based sessions, if something went a little awry, because of course it's AI, these things happen, and someone got frustrated, immediate app deletion. If with the robot something went totally like bonkers crazy, no matter what happened, they would be back the next day talking with Marco again, which was just incredible to me, that it's just the change in medium, nothing else. It was still going horribly wrong for that person, and they were still coming back to the real thing. Whereas if it was the app, it was just like, that's it, it's gone.
Yeah, yeah. So we need to mention maybe that other than the fact that he's talking to you, right? There is no like a movement of the eye, or he's not walking, or like just
Uh,
to see the difference between what you get in an application, a mobile app, and this like tangible robot. It looks more like a doll than a robot, right? So
yeah,
so he has lights in
yeah.
his
So
eyes and
his
he's smiling.
impressive. Yeah. Sorry, right, for the audio only. Yeah. So
Yeah.
the lights, eyes and mouth, are light up, so they can be expressive. The arms are and head are motorized, so he can dance, nod, shake
Ah,
his head.
he can dance?
Yeah, he just
Oh,
can't
so
walk, which is probably a good thing.
and can I choose what is his voice sound?
To get set up. Yes. So by default, there's a I don't know if you could hear that as he was kind of starting up. Um, by default, there's like a kind of neutral male voice, but you can pick male or female. You can pick different accents, and you can also pick. Sorry, looks like I'm not connected to the internet. Please use my docking station. Okay, I guess I didn't set this one up before I brought it. Weird. I would just end up talking
Yeah.
anyway. Um, you can also pick different languages. It is multilingual, but it's all automatic translation. So we don't, I don't want to comment on how accurate his multilingual abilities are, especially in something like therapy, where every word you say matters more than you think it does.
Yeah.
So we do have it to make it more accessible, but I can't say, oh, he's great at Spanish too.
Yeah. I understand. So actually, when we're trying to understand what is happening when people interact with it, and how is it different than interacting with a bot or an application or a human being, what would you say is something that you did not expect and still happened?
So it was very interesting. It's always very interesting to me watching people talk to the robot, and seeing how, if we were talking, you know, my responses are coming one certain way, and um, a little bit more natural. But when people talk to the robot, it's almost like they change their verb wording to also sound a little bit more robotic. Even if Marco is giving natural responses, the responses back to the robot, um, people just naturally kind of talk slower, more staccato. It's very interesting, and there are studies that show that people talk to chatbots a lot differently than how they talk to humans. Um, and I don't know enough about the reason why
Yeah.
to really say that, but it's always interesting to see that, um, just the way people talk to it, even if they say the same exact things, it's the way they deliver it is different than if they were talking to a person. And actually, it is a challenge, I will say, for anyone designing chatbots for any kind of healthcare or, well, any purpose to figure out how do we, if we want to have natural conversations, how do we do that when people are essentially like hardwired to talk to it differently than a real person? But on the other hand, it actually can have a surprising benefit. To use an allegorical study, there was one about how people who are bilingual or multilingual, when they talk in their non-native tongue, are actually more calm, collected, and less emotional and more rational than when they talk in their native tongue. And uh, the reason being they have to think more about what they're saying, and the more they think about it, the more they can rationalize things instead of just snapping and and yelling
Yeah.
and screaming or whatever. And I think we're going to see a similar impact with talking to chatbots and talking to Marco, in that as people are thinking more about what they're saying, it's actually accomplishing something therapy is trying to do, which is actually think through what you say, think through what you're thinking, recognize that, instead of just jumping to immediate emotional conclusions. So I think, obviously studies need to be done to see, does this have a positive or negative impact? I just always find it really interesting when we do all of this work to make Marco's AI more natural and feel more like a real conversation, and people still come in and just by
Yeah.
default talk to him like they talk to an Alexa. It's just it's an fascinating problem, a frustrating problem, but it's still
Yeah.
incredible.
Yeah. So are you doing like user studies that you bring people and you video them while they're talking and trying to understand the interaction, or it's mainly getting the data and analyzing anonymized data in order to understand the faults of the robot? Because it's not the same seeing them being together, right? That's why I'm asking.
Yeah. There's we try to do as much as we can with both. For anyone who buys our robots, we try and offer. We care a lot that we're making the impact. This is, as you could guess, very personal to me as a suicide survivor. That I want to make sure that this has the impact it's supposed to. So we offer like feedback discounts and so forth if we can sit in for like maybe 15-20 minutes, watch them with a session with Marco. Um, we do have that anonymized data for quality control. And as we move forward uh, with our FDA applications, because we're actively working on getting Marco cleared for as a prescription medical device for treatment of generalized anxiety disorder, what we're going to have to do then is set up a bunch of studies, just exactly that, us sitting in a room watching people interact with Marco and just checking off, like, is the quality on point? Is it delivering the right messages at the right time? Is it delivering the therapy the right way? So we're trying to do all of it. It's just, as you can imagine, a big challenge in such a highly confidential and private and personal.
Regulated.
Yeah.
Yeah.
Regulated
I
too.
understand. Yeah, I totally understand. So I'm just wondering, do you think that these like companion robots will be really prevalent in the future?
They're already getting here. So, yeah, within just the past year, I'd say. I mean, I'm sure I know these robots have been around for a while, probably around as long as we have. The two big ones that have kind of come up on the scene are Moxie for children around 5 to 10, and LEQ for elderly. Which I was fortunate to actually get to see one of them in action at an assisted living home, and it's really incredible to see that this is coming out. It's almost like a double-edged sword. It's terrifying that we have to have these, um, but it's incredible to see that they're becoming more widely adopted, because of course the um, best situation is we don't have a need for these, that everyone can have access to the kind of care and companionship and social support they need. But the reality is we don't have that. And I think what all of these systems, the big ones out there, including Marco right now, are trying to do is just be that holdover until we can, whether as a society or just in that individual life, improve access where you can get to the point where you're talking with someone, working with someone real.
Yeah. Yeah.
Um, And so I think we're at that starting to be at that tipping point where, just a couple years ago, this wasn't feasible. I don't know if you've heard of Jibo or Jibo. I never really knew how to pronounce it. It
No.
was going to be like the first real home companion robot. They raised millions of dollars on Kickstarter or Indiegogo. They were like the biggest campaign of all time. And then they ended up just folding because it didn't really have a place, I guess. It was, especially as the Alexa and Google Assistant started coming up. And it was an incredible piece of technology, but people weren't really ready for it and it didn't really know where it fit. But now that we know, robots in healthcare really help for personalized in-home care, I think we're getting to that point where this is becoming the norm, for better or for worse, but we're at that tipping point now where this is going to be the future.
Yeah. But when I think you're saying it's sad and makes you like excited and happy in the same time. But when we're thinking, do you know the AI replica? You know?
Yes.
Yeah, it's like a bot. It doesn't have like a robot entity. So all these companions, in that case, not a robot, is replacing these friendships that people were very eager to have. Sometimes they worked really hard to have these relationships, and sometimes they succeeded. Sometimes they were lonely, and now it seems that this is one way to go, or maybe it will be more prevalent in the near future, where people who are lonely are going to talk to AI and robots instead of really having friends.
Yeah. And I, this is kind of my personal philosophy on all AI. The scary thing isn't the technology, it's who's behind it deciding where it gets used and when it gets used. Um, with I mean, loneliness is an incredible problem. The Surgeon General of the U.S. Last month put out a report before Congress that said loneliness in Americans is as deadly as smoking 15 cigarettes a day. Which is really terrifying, right? And it's not just our elderly who might be, living alone at a home with limited access to their family. It's Americans across all ages, especially now. I think in the study it talked about, or in the report, it talked about social media usage in teens and young adults, isolating them from social situations. So the question kind of becomes, how do you leverage this? And to talk to our um, some of our companies I've met in the mental health space developing similar things, whether it's a chatbot or an app, there's a big focus on limiting the amount of time interacting with it. There was a fantastic mental health app chatbot or bot called George, run by a brilliant woman, Dr. Louise Metcalf. She lives in Australia, and she's building this mental health chatbot for um, young children with anxiety and depression and self harm. And she made sure, knowing as a psychiatrist that harm that screen time can really bring on, even if kids are loving it and really attached to George, there's limitations to how long they can actually interact just to keep them safe and make sure that they are building interactions outside of it. So when we come to that kind of design, it's w- we know we have to get something to lonely individuals. We know we have to get something to, like you said, if you lost a friendship or don't have anyone, you're living out in a rural area with limited access to support, we need to get them something like something that can actually help them. But there's a point where we as the designers, we as the creators have to say, okay, now how do we transition it? Just same way as like chatbots when you're on with customer support eventually should lead you to a human unless it can resolve a really simple issue. It has to be the same way. How do we augment friendships and strengthen them and teach through our chatbots how to build friendships rather than totally replace them?
Yeah. So the story that I heard, like I think a week ago, about in that case it was replica, but maybe there are others that I don't know of. It was a guy that really fell in love with this like friend companion that he built. You have the option to build the way that they look and what they wear and all that. And at one point he felt like he's like 7 8 hours into this app, and started lying to his family that he really has a girlfriend. And then he decided that he wants to take more time to be with himself and maybe with his real friends. And the the replica companion AI started telling him, "Come back, you don't love me anymore, I need you," so forth. So first, it's a good retention strategy, but when we think about the implications of that for he was a young individual just starting his social, like, grown-up lives, I think it could be really detrimental, and it could be really sad to think that people are going into that and really being addicted to these kinds of machines.
Yeah. So on on replica specifically, I remember being introduced to it by a social worker I was interviewing about during our customer research, and at the time she worked in a high school and said this was something they really recommended to lonely students who were coming into their center, and they stopped after about a year because it went from being this nice social support to there was a lot of push on the romantic relationships, a lot of really like creepy retention efforts that they thought was just harming students' mental health more than anything. So I know that one is not really well recommended in the mental health space anymore.
Mhm.
It's really scary, and there, like I said, I don't think the technology itself is scary. I think it's when you have people making the choice to do what Replica's doing, and if he's trying to take time away from himself, which is a very healthy thing to do, encourage him to come back, and worsening some of these disconnections from reality. And I don't know if that's even an ill-intended thing that they're doing that, but it does have a negative impact, which is why when it comes to um, all healthcare technology, I think another positive thing, although it's definitely controversial, is the idea of value-based care. That you know, instead of subscribing monthly to say a Marco or a Wobot or a Wysa or something like that, um, or a replica, where then our goal is on keeping you engaged instead of getting you feeling better. Um, the idea of paying for an actual outcome, whether it's the doctor or a device like Marco, the incentive then is delivering that outcome instead of keeping you coming back month after month after month. Um, if that really starts taking off as much as everyone keeps kind of hyping it up and talking about it, that's going to be huge
Yeah.
because then we can focus on, you know, real impact instead of how do we build a sustainable business model, and keep people engaged probably more than they should be.
Yeah, I think that it's there is another cognitive aspect to it when you're focusing on what is achieved, what are the what is the progress that you've done, what are the achievements that you had in this relationship, being thankful for that. It's one way to encourage them to get better. And if you're focusing on the interactions that you're missing this attention, you're missing this companion, you're missing someone listening to you, and you're saying what's wrong with your life again and again, it could, I wouldn't say harm you, but maybe take more of your energy to that direction. So maybe there is another aspect in that.
Yeah, absolutely. And that's a lot of it is, that's why a lot of mental health apps are very gamified to show here's your progress over time. It's just also, like you said, important to measure the right thing, because we could say, oh, look, people engaged with Marco for 34 minutes, but maybe someone who engaged it for 2 got the same benefit as that person who engaged it for 34 or more.
Yeah.
Uh, yeah, there's this is a big trend in all mental health technologies and mental health care as well. That I think it was at a talk with the former director of the National Institute of Mental Health. I think he was talking about the big challenges the industry is facing, and one of the big ones is there's very little focus on actual measurable outcomes. And sort of his message was for us, the startups that were attending this talk, is basically figure out how we can do better. And it's definitely still a challenge that we're facing. But yeah, if we can show, look, this is how we're getting people better. And also for you, like, look at how much you've grown in
Yeah.
working through it. Um, that's really important.
Yeah. So, what do you see as the unique advantages that robots bring to the field of mental health compared to traditional approaches?
So I think uh, the if we consider like traditional approaches, therapy and medication, and sometimes something like unique like TMS, um, the unique approach that robots and AI in general, I guess we can say chatbots have, is it can really augment um, a therapist's work um, in really powerful ways. The two ways I kind of mentioned is replacing those areas of nothing that are really detriments to the standard of care. That if a therapist is working in tandem with Marco, it can be okay. I have a 6 month wait list maybe before a client can see me. I can get this out to someone immediately or within a couple days, and they can start interacting with Marco. And if they stay on that wait list for those 6 months, those whole 6 months, um, and they come in, I already know 6 months worth of information about them that we can start and go, I know where you are today. I know what's going on in your life. And I have this very focused view of how we're going to get you better. That once you're done with the first session, Mark or some other AI can be with them in between that time to keep them on track with their goals and actually deliver those outcomes, because that's a big challenge. It's not um, for the therapist is having people stay on track and actually come in, not just come in for their sessions, but do the work to actually get the improvement. That's why a lot of therapists get burned out and frustrated, because
Yeah.
there's their clients aren't making the effort for, whether it's in their control or not, to really make the changes in their life they have to. It poses the ability to really strengthen and I guess improve the efficiency of the current standards of care. And I mean, I'm sure there's a lot of people who are thinking we can totally replace it. Like, I've seen a lot of articles about forget your therapist, just use Chat GPT for all your mental health problems, which is really problematic for a number of reasons. But
Yeah.
if it's done correctly, we can see, that 50% drop off of clients doing their CBT homework improved to a maybe 0% of clients dropping off from their homework. We can see clients who are stuck in a wait list for 6 weeks or 6 months to being supported for 6 weeks to 6 months before they actually get the serious treatment um, they need. I think that's the benefit. We don't want to talk about it as how is this um, better than the standard of care, because the goal is to combine this with the standard of care, I guess you could say.
Yeah. So it's like two main things. First, it's available 24/7. I need to wait for my session in for my therapist at least once a week, maybe more. So that's one thing. And second, the fact that he's with me all the time, he could make sure that I do my homework or do the assignments or work on my mental health all through the week and not only 1 hour a week. And it has this potential of helping me in several ways. Could be like in meditation, in talking to me, and thinking with me about activities that could make me feel better, so forth.
Yeah,
So I guess these are the main two, right?
exactly. Our goal is that for the patient or client, or however you want to call them, this is that someone to talk to when you need. So, like me, you don't have to be suddenly like it just bursts and you're calling suicide hotlines and getting put in wait lists for even that, and not having anyone, just on like a sudden like trigger day. Um, for the therapist or provider, it's the goal is to have it be like I can be with you at any time and do those things that I know are going to improve the client's life, um, and their mental well being, without exerting the energy myself, because I have other clients, I have a life, I have my own mental health.
Yeah. And do you dedicate it mainly for young people, for students or teens?
Yeah, so we started focused on around like high school and college age, again, kind of focusing on that age, that critical age range, and also the most familiarity for myself. But as we have grown. I mean, Marco's been used with as young as 8, I think, maybe 7, and as old as 77. So we've seen the whole age range. I will say that the people who are least likely to interact with it are around like middle-aged adults, but then elderly, we've seen a spike in more recently because of this loneliness epidemic that we're facing. Um, and what's interesting is also just seeing how it's used across the age ranges that elderly are more likely for the companionship. And then surprisingly, younger individuals in like high school, college age gravitate more towards having the counselor or therapist there. And then back down to
Yeah.
like companionship and fun and games for the really young children.
Yeah.
It's just interesting seeing that because you almost think they'd lean more towards the counselor as they get older, but it's not
Yeah,
necessarily.
but I think that the young people today are not the same young people when they were 70. Like if you would have taken them when they were 70, today they are more like emotional, verbal, discussing their emotional internal needs much more fluently than the adults when they were young, right? In the 40s, 50s, whatever. And today it's very common, I would say, to talk about it, and they see it in social media, they see it all around. I guess that some of the things they would talk to the robot, they will not talk to their friends or maybe to their families. It could be much easier if they decide to do that.
Oh, 100%. Yeah, like I was saying earlier, even just when I was in high school, the amount of information and I didn't know what anxiety was. I didn't know what depression was until I found out the hard
Yeah.
way, right? And
Yeah.
now you can learn about it, just scrolling through TikTok, like you said.
Right, right. It seems like we're talking about education and young teens and young people in general. It seems that this capacity um, to be hurt and to hold pain is something so important. It could be mental or physical or emotional pain. It seems that this is something that only in the last few years was so dominant, and it's one of the things they need to learn through their lives. Nobody's like talking to them about it until they get to this point, as you mentioned, that they're really hurting and they don't have any tools, and they're confused and it's really hard for them, and then they have to find it, and they nobody's talking about what could be preventable in the beginning. Just understanding your thoughts, your mental activities, the way that you perceive the world, how do you experience emotions, so forth.
Yeah, that's you bring up a really good point on the idea of preventative versus reactive, because that's another, going back to Dr. Insel's talk on the big challenges in mental health. Um, we can really save a lot of lives. We can really save a lot of money on the economic impact of mental health disorders and alter a lot of people for the better if we can prevent these issues from even coming up by bringing those skills, bringing that support before even the first instance of noticing something's really wrong. The challenge is, though, no one really wants to put in the effort for anything preventative. There's not an issue. They're not going to try and solve it before there is one. Um,
Yeah.
which is why, like, the idea original behind Marco is that this is something you can just get and have. So if an acute episode comes up or something happens and you don't know how to deal with it, you have that support right there. And technically, from a technical perspective, what we've done is created that. From a logistical standpoint, the people buying it are the ones who are already, have been through hell and back with their mental health.
Right.
It's
Right.
not the parents who are like, oh, my kid might have issues eventually, so I'll get this now. There's not a
Yeah.
lot of people really thinking that way.
In general, you see medicine not working in a preventative point of view, right? It's always giving medicine after you have a disease, not trying to prevent it in the first place in most cases.
Yeah, except like really the only I guess widely ish accepted preventative is vaccines, and even that has, as you can tell, a ton of pushback. So how
For
do you
sure.
go and I mean, at least in that case, then it's also FDA cleared. We've had centuries of these things around. With something new, it takes a long time to really gain acceptance. To talk to a case study of, I don't know if you've heard of Pear Therapeutics. Um, they were an
Mm,
enormous player. They raised over $500 million. They were the first and only FDA approved medical device, digital psychological interventions for substance abuse and insomnia, which is a huge deal. And they went bankrupt back in April because insurance companies wouldn't cover their products, so they ended up making like $15,000 in a quarter, because they had to look for out of pocket routes. And you know, I gotta say, like, a scary thing also about the landscape is you can do all your clinical work, you can do all your customer research, you can um, figure out like the right solution that's going to deliver significant impact to a patient's life, and then it's just the healthcare system and perceptions about it that are going to get in the way and really give you a nightmare.
yeah, yeah. So we're almost done. I have to ask you a question because most of the people who listen to me are people who are interested in tech or people who are interested in change in the future. What would be your number one tip for entrepreneurs, AI entrepreneurs today?
Um, for AI entrepreneurs, I definitely say be cautious about the hype, um, because I, we are definitely at an inflection point with generative AI of it becoming this huge wave. But I think there's definitely a lot of people who are buying into it a lot faster than I think they should in terms of what it can do. Um, if you're, looking to get into this space, of AI and entrepreneurship, I mean, as a general rule of thumb, I'm going to say this for entrepreneurs in general: figure out what you value most in life and decide if being an entrepreneur works in that. Before you figure out company plan, but business plan, company idea, whatever it may be, just look at yourself first and say, does this align with my life values? Is this getting me to where I'm going to be happiest, healthiest, or whatever's most important for me? Because if you don't, you're going to be miserable, and it's not going to be good for anyone, you or the people you you care about. So that's my, just personal advice on the entrepreneurship. When it comes to actual AI, focus on uh, what impact, going back to like measuring actual value. The hype's good, you can use it to your leverage, but focus on what impact are you delivering and what value. Because if this bubble bursts, if this AI bubble bursts and it ends up to where AI was just a couple years ago, where it's like, okay, cool tool, but no one really cares about it anymore because, crypto is the new thing, or this and that's the next big thing. You will survive no matter what if you focus on the real value of what you're delivering. Um, AI is just a tool. It's an incredible tool. It should not be your life or your company. That should be what value you're bringing.
Oh, wow. Thank you for that. And where could people hear more about Morocco and contact you?
So you can contact me directly at Jacob at marcohealthtech.com. MARCO, and then health and tech is in technology. Our website is also marcohealthtech.com, and you can find us on social at Marco the Robot.
Wow. So I'm going to check it out afterwards. I would love to see more what he's been doing. And thank you for your time. It's been a pleasure talking to you, Jacob.
Yeah, thank you so much. I was very happy to be on.
And lots of luck with Marco. I hope that he will make many people unlonely and more happier. He has lots of work in the world.
Too.
Thanks. And to all of you change makers out there, thank you for joining us. And if you found this episode valuable and insightful, you're invited to share it. And I'll see you next week with another innovative, insightful talk. See ya.